First heart sound is S1 and second heart sound is S2. Gap between S1 and S2 is known as systole, and gap between S2 and S1 is known as diastole. In between S1 and S2 there is ejection click just after isovolumetric contraction, and in between S2 and S1 there is opening snap just after isovolumetric relaxation. S3 seen in rapid ventricular filling and S4 seen in atrial systole. S1 is due to closure of mitral and tricuspid valve. S2 is due to closure of aortic and pulmonary valve. Ejection click occurs due to opening of aortic and pulmonary valve. Opening snaps as result of opening of mitral and tricuspid valve. S3 is due to rapid filling. S4 is due to atrial systole. Auscultatory area. Mitral areas is a fifth intercostal space on left side just medial to mid-clavicular line. Aortic area is second intercostal space on right side. Pulmonic area is on second intercostal space left sternal border. Tricuspid area is on fourth intercostal space left sternal border. Erb's point is a third intercostal space left sternal border. Remember, S3 and S4 are low-frequency sound which can be heard by bell of stethoscope. Mid-diastolic murmur of mitral stenosis is a low-frequency murmur which is best heard by using bell and on left lateral decubitus position.